Welcome back to ActiveFit, where today we will provide you with valuable information on health and wellness. In today's video, we'll be discussing an important topic, the warning signs of an injured hip. Our hips play a crucial role in our overall mobility and daily activities, so it's essential to recognize these signs early on. Let's jump right in. Number 1. Persistent hip pain. Our hips are weight-bearing joints that undergo significant stress with movement, so experiencing ongoing discomfort or sharp, shooting pain in your hip joint can be alarming. This type of pain may be caused by various conditions, such as hip bursitis, tendonitis, or even hip osteoarthritis. We'll discuss the types of pain to look out for, such as aching, throbbing, or a deep discomfort, and when it's time to seek medical attention. Hip pain can affect your quality of life, hindering your ability to walk, stand, or even sleep comfortably. Ignoring persistent pain can lead to further damage and complications, so it's crucial to address it promptly. We'll provide insights into the potential causes of hip pain, such as overuse injuries, hip impingement, or hip labral tears, and discuss treatment options to alleviate discomfort and promote healing. If you're experiencing hip pain that doesn't improve with rest and self-care measures, it's essential to consult a healthcare professional. Early intervention can make a significant difference in managing hip injuries and preventing long-term issues. Number 2. Limited range of motion. The hip joint is designed to have an extensive range of movement, enabling us to perform various activities like walking, climbing stairs, and bending. If you find yourself struggling to perform these movements or notice stiffness and difficulty moving your hip freely, it could indicate an issue with your hip joint. Limited range of motion may be caused by conditions such as hip arthritis, hip flexor strains, or even hip fractures. There are specific limitations you may experience, such as reduced flexibility and difficulty lifting your knee or rotating your hip. Ignoring limited range of motion can lead to compensatory movements and muscle imbalances, which may worsen the injury over time. Early intervention and targeted rehabilitation exercises are especially important to restore hip mobility and function. Number 3. Stiffness and soreness. Stiffness and soreness in the hip area can be indicative of an underlying injury. If you're experiencing discomfort when you start moving after periods of inactivity or notice soreness during or after physical activity, it's crucial to pay attention to these warning signs. Hip stiffness and soreness can be caused by various factors, such as muscle strains, ligament sprains, or hip joint inflammation. There are many common causes of hip stiffness and soreness, such as trochanteric bursitis, hip labral tears, or even hip flexor tightness, and provide strategies for managing these symptoms. Engaging in gentle stretches, warm-up exercises, and using heat or ice therapy can help alleviate hip stiffness and soreness. However, if the symptoms persist or worsen, it's essential to seek professional evaluation to determine the underlying cause and receive appropriate treatment. Ignoring hip stiffness and soreness may lead to decreased physical activity, which can impact your overall health and well-being. By addressing these symptoms early on, you can prevent further discomfort and promote better hip function and mobility. Number 4. Grating or clicking sensation. A grating or clicking sensation in the hip joint can be a red flag for an underlying issue. If you notice these sensations when moving your hip, it's essential to address them promptly. A grating or grinding sensation, also known as crepitus, may occur due to irregularities in the hip joint surfaces, such as cartilage damage or hip osteoarthritis. Clicking or popping sensations can be caused by snapping hip syndrome, where tendons move over bony structures during movement. There are a variety of issues that can cause these sensations, including hip labral tears, hip impingement, or hip instability, and it may be necessary to seek professional evaluation. In some cases, these sensations may be accompanied by pain or limited range of motion, further indicating an underlying issue that requires attention. Ignoring grating or clicking sensations may lead to further joint damage and exacerbate existing conditions. Early diagnosis and intervention can help manage these symptoms effectively and prevent further complications. Number 5. Swelling or bruising. Swelling or bruising in the hip area is a significant warning sign that shouldn't be ignored. If you notice swelling or discoloration around the hip joint, it may indicate an injury or trauma. Swelling in the hip can occur due to hip bursitis, inflammation of the fluid-filled sacs that cushion the hip joint, or hip fractures. Bruising may result from direct impact or trauma to the hip area. We'll delve into the potential causes of swelling and bruising and provide guidance on when to seek medical attention. In some cases, swelling and bruising may be accompanied by severe pain and difficulty bearing weight on the affected hip. Ignoring swelling or bruising can lead to complications and delay proper treatment. Seeking medical evaluation promptly can help determine the extent of the injury and initiate appropriate care. This may include rest, ice, compression, and elevation, RICE, therapy, or more advanced interventions like physical therapy or surgery. Remember, your body's signals are essential to pay attention to, as they guide us towards optimal health. If you're experiencing any of these warning signs, we always strongly recommend consulting a healthcare professional for a proper diagnosis and treatment plan. And there you have it, 5 warning signs of an injured hip. Recognizing these signs early on can help you seek appropriate care and prevent further complications. Your hip joint plays a crucial role in your mobility and daily activities, so it's vital to pay attention to any discomfort or changes you experience. If you're encountering persistent hip pain, limited range of motion, stiffness and soreness, grating or clicking sensations, or swelling and bruising around the hip area, please don't hesitate to seek professional evaluation. Early diagnosis and intervention can make a significant difference in managing hip injuries and promoting a healthier and more active lifestyle. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more informative content on health and wellness. Remember, your well-being is a priority, and recognizing warning signs is a proactive step towards better hip health. Thank you for watching, and we'll see you in the next video. Always listen to your body, take care of yourself, and stay informed about your health.